This is ACEP's Capital Minute, a look at what's happening in Washington, D.C. right now that's affecting emergency physicians and patients. I'm Laura Worcester. The political landscape has changed, and Democrats will control the House of Representatives for the first time since 2010. The dust continues to settle from the 2018 midterm elections, which will break records in both dollars spent, nearly $5.2 billion, and voter turnout. More than 47% of the voting-eligible population cast a ballot in the midterm elections last Tuesday, according to early estimates from the United States Election Project. House Democrats will most likely end up with a 35 to 36 seat majority, although several races have not yet been called as of this writing. This is still a slimmer margin than the current Republican majority of 45 seats. In the Senate, Republicans maintain control. While the winners in 2 state Senate races are still being determined, Republicans currently hold a 4-seat majority. NEMPAC donated nearly $2 million to candidates and national party committees during the 2018 elections. Altogether, 227 candidates for Congress were supported, 203 for House races and 24 for Senate races. Nearly 84% of these candidates won their elections. As many as 22 of the open seat and challenger candidates that NEMPAC supported will be coming to Congress next year. Stay with ACEP with all of the latest news regarding the new Congress and how it will affect emergency care. ACEP President Dr. Vitor Friedman was at Washington's Newseum this week participating in a post-election roundtable discussion sponsored by CQ Roll Call. The event, entitled Election Impact: Improving Patient Care Under New Congress, featured Dr. Friedman, as well as leaders from other major health organizations such as the Healthcare Leadership Council, National Hispanic Medical Association, and the Alliance for Health Reform. Rebecca Adams with CQ News moderated the discussion that touched on the future of the ACA under the new Congress, as well as opioids, drug pricing and shortages, and out-of-network billing.
It shows that our visibility in Washington is improving. And visibility equals the ability to influence, and if we can influence things, that's better off for our members.
ACEP was the only medical specialty society that was invited to participate in this event. To view the event, please click on the link below. On Tuesday, the Centers for Medicare and Medicaid Services sent out a letter to state Medicaid directors announcing more flexibility for them around treatment for adults and children with serious mental illnesses. Specifically, states will now have an opportunity to apply for a Medicaid waiver that would allow them to pay for short-term residential treatment services in an institution for mental diseases, or IMD, for these patients. This policy broadens the ability for states to work around the current Medicaid IMD exclusion, which prohibits the use of federal Medicaid funding for care provided to most patients in non-hospital inpatient mental health treatment facilities. Before this announcement, CMS only allowed states to waive the Medicaid IMD exclusion for patients with substance abuse disorders. ACEP has long advocated for the full repeal of the Medicaid IMD exclusion, and this policy is definitely a step in the right direction. More prudent layperson violations by insurers. Last week, ACEP responded to a new Harvard Pilgrim policy that will be implemented in New Hampshire on January 1st that would apply a new 50% coinsurance for policyholders who seek care in an emergency department. Their primary diagnosis turns out to be non-emergent, based solely upon a list of almost 6,000 diagnosis codes. In the letter, ACEP calls for Harvard Pilgrim to halt implementation of this dangerous policy that expects patients to be able to self-diagnose when deciding whether to seek emergency care. This policy follows efforts by other insurers to limit coverage of vital emergency care, including a similar anthem policy already in effect in New Hampshire and several other states. ACEP remains committed to preserving the prudent layperson standard and continues fighting insurers' attacks on emergency care at the federal and state level. That's ACEP's Capital Minute for the second week of November 2018. I'm Laura Worcester. Thanks for joining me, and we are wishing you a very happy Thanksgiving holiday.